Hey guys, yeah, really happy to have our guest of the day joining us today, Dr. Roger S. Mcintyre, psychiatry and pharmacology professor at the University of Toronto and CEO of AltMed under the Champignon Brands umbrella. Going to talk to us a little bit about some work he's doing with the Canadian Rapid Treatment Center of Excellence over in Mississauga here in the GTA when it comes to treating depression with the drug ketamine and also some psychedelic research as well. Great to have you on the show. Dr. Mcintyre, how are you on this Friday?
I'm doing very, very well, and just the way you preface it actually gives me plenty of room for excitement. You're absolutely right. This is a center that we do have in Mississauga. That was our initial flagship location, but we are, in fact, having a very, very clear, concrete, and actionable plan that we're going to really act on over the next 3 to 6 months as it relates to what you just said, ketamine and psychedelic treatments.
When it comes to the research side, I want to get into the center and some of the treatments that and some of the successes that you've been having with the treatment. When it comes to the research side, first off, tell us a little bit about some of the progressions that you've made when it comes to the psychedelic side of things on research for mental health.
I'm so glad you started with that because this is critical, not only from the regulatory perspective, that is regulators like the FDA, Health Canada, other organizations, EMA in Europe. They are very, very clear. They're very excited about the opportunity of ketamine and related products, psychedelics and related products, but they want to see the research conducted at the most well-established centers in research. According to ExpertScape tracks not only academics and researchers, but also centers. ExpertScape has identified my center in Toronto as the most influential center in the world in depression research. That bona fide is relevant because it differentiates our center from any center in the world conducting ketamine and psychedelic-based research. Critical because we are trying, in fact, to do best practices to determine whether and how these treatments work. My center is the first center in Canada to have Health Canada approval to conduct randomized controlled trials with psychedelics. So we were the first inpatient in this country, something we plan to also have in other countries around the world. So we're fully licensed to conduct psychedelic and related research, and we've already acted on that license, first center in the world to do it. So relevant, not just to the regulator, as I said, but also, I think, to the differentiation of who we are versus any other organization in the world.
When it comes to the individual treatments and the individual drugs, we've had other companies in this space on the show before that have talked a little bit about the more psychedelic side of things. When it comes to ketamine, tell us a little bit about why you chose ketamine to start with.
It really begins with observation. I've been a psychiatrist for over 2 decades, and I have the largest volume center in North America that is dedicated to seeing people with depression. And that first-hand experience, I've had tens of thousands of patients, told me that we need 3 new ways to go. We need treatments that are better, faster, and get people back to work. This is an incredible unmet need, and ketamine has delivered. We're getting people not just better, but getting them better within 1 to 2 days. And things I've never seen in my career, getting people back to work, which is really the grand prize, what we're trying to do for so many people. And I'm using the word work broadly. This could be work outside the home, inside the home, just work in general. What's especially been exciting for us is, in fact, to take this observation and think about it from a business perspective. We know that in North America, the market opportunity here is over $10 billion in central nervous system products that are, in fact, available. And what the field is thirsty for is innovation, and innovation will be, in fact, rewarded. And what we decided to do was act on the observation, the unmet need. We went with ketamine, but we're expanding now into psilocybin-related products to deliver what patients need, which I described, this rapid onset, effective, get people back to their previous role type treatments, but treatments that are going to be, in fact, very, very disruptive with respect to the current marketplace. And this marketplace has been very clear on both sides of the Canada-US border. It's going to reward innovation in ketamine and related products. We've already seen, for example, in the United States, Centers for Medicare and Medicaid is paying for ketamine and related treatments. And we're seeing, in fact, a similar signal in U.S. public and private payers.
It's incredibly, an incredibly interesting space. So much going on, so much development happening right now. When it comes to the research side, talk to us a little bit about the timelines that are required for the actual testing. Primarily, you're obviously focusing on ketamine right now, but in the future, what are the timelines like going out as far as the additional research goes?
There's two timelines. There's a timeline for my organization, and there's a timeline for everybody else. The timeline for everybody else will be about 2 to 3 years. The timeline for us is going to be about 3 to 6 months. Why the different timeline? Because we've already got all the licenses in place. We already have the infrastructure in place. We're focusing on ketamine, psilocybin, related types of psychedelic products. I call that the software. What you need also is the hardware. You need the infrastructure in place, the good clinical practice, the research credibility in order to do this. My center is the only center that has all of this. We have the volume, we have the research infrastructure in place, and we have the assets that we can work with. All of this is required for timely innovation. No other center has this. The overall approval process will take about 2 to 3 years. This is a significant differentiation. So when we take what we have right now, which we're going to do, and we're going to move into New York and Florida and California to start with, where I have a footprint already, we're already in late stage discussions with colleagues to begin opening centers like I'm describing that really will recapitulate my center in those high populated areas beginning in the next 3 to 6 months. So there's two different timelines, that timeline for everybody else and the timeline for those who already have a licensure to do this and already have the research experience to deliver in this area.
A lot of people obviously involved in the trials and involved in the testing at this point, but if anyone watching wanted to, to get some more information when it comes to what it is you're doing, where can they go for that?
Well, they can certainly go to our website at altmed.ca. They can certainly go there, and they can certainly go online. Just type my name in, Roger Mcintyre, and reach out to me anytime, Roger Mcintyre at uhn.ca. But certainly go to altmed.ca, and we'll be certainly happy to have a discussion with them.
Fantastic. Great information. I mean, best of luck, Dr. Mcintyre. It's a very interesting field, a very interesting space. Hopefully we can have you back on to update us on your progress.
It'll be a pleasure. Thanks for covering it. It's an exciting area. And once COVID-19 is behind us, we're going to, in fact, have a lot to say about the mental health of the general population. Thanks for having me.
There we go, guys. Great stuff. Dr. Mcintyre joining us from AltMed and Champignon Brands, talking a little bit about the effectiveness that he's had at the Canadian Rapid Treatment Center of Excellence when it comes to treating depression with ketamine and some psilocybin and psychedelics. So a space that we've continued to cover on the show and will, as it is very, very interesting. Let's go back to the guys.